Hi, everybody. Hope y'all are having a great Wednesday. I'm gonna wait a couple minutes and then I'll get started. Thank you. I love this filter too. I'm always finding really nice filters to do my lives with. Just to add a little razzle dazzle. All right. I'll just go ahead and introduce myself. My name is Soul. I'm one of the social media influencers for community health. I'm an art educator for Whitman-Walker's cultural center called the Corner DC. And I am a host of Floetic Uptown, which is the youth open mic series, and the host of the Bag series, which is tonight. Our DJ tonight is DJ Sean Don. To join us, all you have to do is RSVP with the link in the bio. Or you can just look at the comments and go to that link to RSVP and join us for our last Bag series. We usually just gather to talk about women's sexual health and have some girl talk and, just dance and enjoy each other's company, virtual company, and grooves by our two resident DJs, DJ Alex Love and DJ Sean Don. Tonight it's DJ Sean Don, so it's going to be another good night. My pronouns are she, her, hers. Some you can use they, theirs. Yeah, as long as you're respectful, it's all good. All right, so let's get into it. Today our topic is about breast and chest health. Feeling heaviness in the chest can result from various mental or physical health conditions. People sometimes associate a heavy feeling in their chest with heart problems, but this discomfort can be a sign of anxiety or depression. A feeling of heaviness is one way that a person may describe chest pain or discomfort. Chest discomfort or pain may be a key warning symptom of a heart attack. So if you have any of these symptoms of a heart attack, call 911 or other emergency services immediately. After you call 911, the operator may tell you to chew 1 adult strength or 2 to 4 low dose aspirin. Wait for an ambulance. Do not try to drive yourself. Since most of the damage to the heart muscle during a heart attack occurs in the first 6 hours, emergency treatment may prevent damage to the heart muscle and death. For men and women, the most common symptom of chest pain is pressure. For men and women, the most common symptom is chest pain or pressure. Women are somewhat more likely than men to have other symptoms like shortness of breath, nausea, or back and jaw pain. Check your symptoms to decide if and when you should see a doctor. Chest wall pain can have a number of causes, including pulling a muscle in your chest, inflammation around the ribs, a medical condition such as angina or gallstones. Breast/chest pain can also have a number of other causes, but on its own, it's not usually a sign of breast cancer. So since there's no way to prevent breast cancer, there are things that you can do that might lower your risk, such as changing risk factors that are under your control. A risk factor is anything that increases your chances of getting a disease, such as cancer. But having a risk factor, or even many, does not mean that you are sure to get the disease. While you can't change some breast cancer risk factors, family history and aging, for example, there are some risk factors that you can control. There's no sure way to prevent breast cancer, but there are things that you can do that might lower your risk. This can be especially helpful for women with certain risk factors for breast cancer, such as having a strong family history or certain gene changes. So let's talk a little bit more about breast cancer. Breast cancer starts when the cells in the breast begin to grow out of control, forming tumors. Tumors can be benign or cancerous, or also known as malignant or invasive. If they invade your body surrounding tissues and organs or spread to other areas of your body. The BRCA, or breast cancer, gene is the most common gene to mutate and cause breast cancer. Women and men who inherit this mutated gene are at increased risk of developing breast cancer and can also pass these genes on to their children. A patient can meet with a genetic counselor to meet with a genetic counselor to discuss their risks and options. By using information about the family history of cancers, the genetic counselor can recommend whether genetic testing for the breast cancer is indicated or not, and if testing is recommended, which breast cancer genes should be tested. Many types of breast cancer cause tumors in your breast, but not all do. You should also watch for these symptoms: breast or nipple pain, nipple discharge, nipple retraction, which means your nipples turning inward, redness, scaliness or thickening of the nipple or breast skin, skin irritation, dimpling, swelling, or all or part of the breast. You can self-examine yourself with a breast self-exam or regularly examining your breast on your own. That can be an important way to find breast cancer early when it's more likely to be treated successfully. While no single test can detect all breast cancers early, breastcancer.org believes that performing breast self-exam in combination with other screening methods can increase the odds of early detection. So I'm just going to tell you all a few steps that you can take to check and self-examine yourself for breast cancer. And I will demonstrate just a little bit. I don't have a mirror in front of me, but you can start by looking at your breast in the mirror with your shoulders straight and your arms on your hips. So just kind of like a little bit to the side, a little bit slanted so that you can see both of your breasts. You should look for, you should try to see if your breasts are your usual size, shape, and color. Make sure that your breasts are evenly shaped without visible distortion or swelling. If you see any of the following changes, just bring them to your doctor's attention. If you see dimpling, puckering, or bulging of the skin, a nipple that has changed position or inverted nipple, which is pushed inward instead of sticking out. If you see any redness, soreness, or swelling. You can also, while you're self-examining, raise your arms and look for the same changes, which means, the dimpling, the puckering, the bulging of the skin, if there are any changes in your breast size, shape, or color, if they aren't looking evenly shaped anymore or have some distortion or swelling, if you see redness and soreness. While you're at the mirror, you can also look for any signs of fluid coming out of one or both nipples. This could be watery, milky, or a yellow fluid or blood. So again, that's while you're standing naked in front of your mirror. You can do this and just look at them, do a nice visual exam. Next, you can feel your breast while you're lying down, using your right hand to feel your left breast and then your left hand to feel your right breast. You can use a firm, smooth touch with the first few finger pads on your hand. So you can use like 2 or 3 fingers in the top of these. Keeping the fingers flat and together, and use a circular motion about the size of a quarter. Obviously, it'll feel differently when you're laying down, but if you're laying down, you can put your arm over your hand and then just feel around for lumps. You can move in a circular motion so that you can feel a little bit more deeply for some lumps or any distortion or swelling in your breasts. Make sure you're covering your entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of your breast. And you can also move your fingers up and down vertically in rows, as if you were mowing a lawn. The up and down approach seems to work best for most women, but just be sure to feel all of the tissue from the front to the back of your breast. For the skin and tissue just beneath, use light pressure. Use medium pressure for the tissue in the middle of your breast, and then use firm pressure for the deep tissue in the back. When you've reached the deep tissue, you should be able to feel down to your rib cage. Finally, you can feel your breast while you're standing or sitting. Many women find that the easiest way to feel their breast is when their skin is wet and slippery, so they like to do it when they step in the shower, or when they just step out of the shower. You can cover your entire breast using the same hand movements described in the last step, which is, the circular motions and making sure that you're covering your whole breast. I hope that was helpful. Be sure to visit breastcancer.org for a step-by-step guide on how to do a self-exam. As always, you can reach out to Whitman-Walker for any more information about sexual health education or up-to-date information about Whitman-Walker Health Services. Remember to follow us on IG, Facebook, and Twitter at Whitman-Walker. And thank y'all for joining us. Don't forget to RSVP for the bag series tonight, and to learn some more about tools for your sexual health toolkit. I hope to see some of y'all tonight. Have a great Wednesday.